Good day, viewers. Echo Blog is reporting live at the Nigerian Institute of Medical Research Cancer Center, Yaba, Lagos, where experts, researchers, and health stakeholders have gathered for the October edition of Media Chat with the theme Randomized Clinical Trials, a cornerstone of research. This is an insightful program focused on advancing medical research and improving healthcare outcomes in Nigeria. So stay tuned as a co-op blog brings to you the live coverage of the event as it unfolds. I am Susan Amalaya reporting for a co-op blog. On Wednesday, October 22, 2025, the Nigerian Institute of Medical Research, Yaba, Lagos, hosted its media chat for the October edition with the theme Randomized Clinical Trials, a cornerstone of translational research, bringing together researchers, medical professionals, health writers, and health stakeholders to discuss the significance of clinical trials in improving healthcare outcomes and public understanding. Dr. David Oladele, a Chief Research Fellow and Head of Department of Clinical Sciences, Nigerian Institute of Medical Research, offered a comprehensive overview of the phases of clinical trials, phase 1 to 4, which covers both infectious and non-communicable diseases. He highlighted NIMR's bold step towards establishing a national clinical trial network, a visionary step towards a unified and impactful research.
We know that NIMR was put together by the Act of Government in 1977. That was under the Prime Minister of Science and Technology, later we moved to Prime Minister of Health. And the mandate of NIMR is to conduct research, which is of public health importance in Nigeria, and develop innovations and provide evidence for national health policy. And as part of this mandate, I want to submit that randomized clinical trial remain a key operational area through which NIMR evaluates safety, efficacy of drugs, vaccines, diagnostics, and of course public health interventions, and build capacity within Nigeria sector towards this. So we have been able to do a lot as we had the last 3 to 2 decades on shaping treatment guidelines, policy decision, and building capacity for healthcare provider in Nigeria in the space of research and also clinical trial. So you ask me, what is a randomized clinical trial? It simply means that we study where participants, we don't use subjects in current balance use participants, are randomly assigned to different groups and compare the effect of treatment. It could be drug, it could be vaccine, between them and a control. A control could be the standard of care, all right, or could be a placebo. What's a placebo? A placebo is an element that's inert, doesn't have an active substance, but look exactly like the drug you are trying to try. So it is not clear for a patient to know what it is.
Dr. Pascal Ezeobi, a senior research fellow at the Clinical Sciences Department, Nigerian Institute of Medical Research, in his presentation titled Predictors of Antiretroviral Immune-Reconstitution Bone Loss Study, traced the history of NIMR's HIV Research Center, which has served over 26,000 patients since its inception in 2002. He spotlighted the Institute's collaboration with Emory University, USA, funded by the U.S. National Institute of Health, a giant strides in the medical sector.
Over the years, we have carried out, been part of different research programs involving HIV opportunistic infections and hepatitis viral infections. And then we know that HIV has been seen as first as a threatening illness that once certain the life of the person that is infected, so to say, would be under threat. But over time, with the advent of antiretroviral therapy, this picture has changed, and HIV is no longer an infection that is seen as a killer disease as such, and because the antiretroviral drugs has helped to improve the quality of life of the persons that are living with HIV once they are placed on it and they are correctly using the drugs. The drugs reduce the load of the virus and the persons concerned, making them to drop to undetected levels, and as such, their quality of life improves, and also the risk of transmitting the disease to other persons is also reduced. HIV is now a disease, a chronic, very much a chronic disease, the same way we see hypertension and diabetes, and where the persons that are infected are seen regularly and given appropriate care. They are on medications and they are evaluated at appropriate intervals and changes made if need be. So the NIMR HIV Treatment Center began in 2002, as Dr. Oladele had already mentioned, and over time, we have cumulatively attended to over 26,000 persons that are living with HIV, including children. Over time, we also do see effects of these drugs. The drugs, no longer the effect of HIV, but the effect of the drugs in them. So that brings us to what I want to talk about next, which is a study that we started, which we refer to as Predictors of Antiretroviral Immune-Reconstitution Bone Loss study, which we began in 2021, in September 2021. It's a study that the Nigerian Institute of Medical Research is carrying out in conjunction with Emory University in Atlanta, Georgia, United States of America. It is supported or sponsored by the National Institute of Health and also the National Institute of Musculoskeletal Diseases in the U.S.
Next, Dr. Agatha Wapmuk, a public health physician and research fellow at the Nigerian Institute of Medical Research, presented on human papillomavirus and cervical cancer prevention project, which supports vaccination for girls from age 9 to 14 and women from age 30 to 65. She emphasized that early immunization and screening remain key to reducing cervical cancer in Nigeria.
The Access HPV project is a cervical cancer prevention project. And why is it so special to us? Cervical cancer is a disease of public health importance. But interestingly, it's one of the most preventable, it can be prevented by 100% and most treatable forms of cancer if detected early and treated effectively. Globally, cervical cancer is the fourth commonest cancer among women. It's been reported by the World Health Organization in the year 2020 that there were over 600,000 cases of cervical cancer with 342,000 deaths of cervical cancer. And 90% of these cases and deaths occurred in low and middle income countries. Nigeria is one of those countries. The World Health Organization launched a strategy in 2020 to accelerate the elimination of cervical cancer as a public health challenge by the year 2030. And how is it going to achieve this? It's using a three-pronged approach. And one of it is to vaccinate girls, 90% of girls by the age 15 years. And the next strategy is to screen 70% of women with high-performance test, which is HPV test, at the age of 35 and 45. And the final one is to treat 90% of women diagnosed with precancerous lesions or invasive cancer adequately. And with this, it will be able to eliminate cervical cancer. The Nigerian Institute of Medical Research has always played a key role in cervical cancer prevention in Nigeria. And in order to strengthen this role, this project was birthed, which is the Access HPV project. It's a cervical cancer prevention project, as I have stated earlier on, and it's in collaboration with Washington University in the US, University of North Carolina at Chapel Hill, Wake Forest School of Medicine in the US, Monash University in Australia. And what are the aims of this project? We aim to improve the uptake of HPV vaccination among girls 9 to 14 years and improve HPV screening among women 30 to 65 years in Nigeria. There were some challenges along the line while we were implementing, because going into the community, you find out that, yes, there are prevailing myths and misconceptions about the HPV vaccine. And so it gave us an opportunity to engage the community and address such concerns. And with that, we're able to get a buy-in from the community to improve the uptake of HPV vaccination amongst those that were enrolled. And the availability of the high performance, the brushes used for the screening is something not readily available in the country. And so with this, has been promoted, HPV vaccination and HPV screening has been promoted as an effective cervical cancer prevention strategy. But there's limited access to this, and that is what we're trying to do to ensure that we improve the uptake to these services, thereby contributing to cervical cancer elimination.
The event transitioned into a dynamic question and answer segment where participants engaged directly with panelists. The dialogue provided clarity on pressing health issues and fostered deeper understanding of ongoing research efforts. Professor John Obafunwa, the Director General of the Nigerian Institute of Medical Research, in his closing remark expressed gratitude to all attendees and commended the media role in shaping public awareness, urging consistent collaboration between health reporters and researchers. It reaffirmed NIMR's commitment to advancing translational research that bridges laboratory discoveries with practical health application.
I say a big thank you to us all for making this possible. And whatever we've not done quite well, please forgive us. We'll improve as we go along. We still have a program over the next 12-15 months, I believe. And if there are issues that you feel we still need to clarify, it would be a good idea to mention them and clarify them.
The eventful evening concluded with a photograph session capturing moments of insight, collaboration, and shared purpose. For Echo Blog, this is Susan Omalayo. It has been an enlightening session right here at the Nigerian Institute of Medical Research, Yaba, where discussions on randomized clinical trials continue to shed light on the future of medical innovation in Nigeria. Thank you for staying tuned. Kindly follow us on all our social media platforms on X, Instagram, and Facebook at Echo Blog. Also subscribe to our YouTube channel at Echo Blog. Susan Omalayo, reporting for Echo Blog.